Hello, and welcome to the Children's Safety Network State Technical Assistance webinar in May 16th, 2024. We are excited to have you all joining us today. And for those who have never been here to a State Technical Assistance webinar, this is an engaging webinar. We are very much looking forward to engaging all of you in verdant discussion and exchange. So we want to get to know you. We encourage, if you're comfortable and able, to turn on your camera, and we will have opportunities to see one another, to add to your name, your role, to add to your name the state that you belong to, and to share in the chat with us what your role is, what state you belong to, and what key topic areas that you're coming today with an interest in. And again, we know many of you work across many different children's safety topic areas, but if there's one that you're thinking about as we talk about data today, it'd just be great to have a sense of who's in the room and what they are focusing on. So I see that Kelsey's here from Rhode Island, and LaDonna from Tennessee. It's great. Welcome. And I know also, as we're getting to know one another, that we all, had this unique experience over the last week where the aurora borealis was visible in many places that it is not normally so. And so I'd love to know if anybody was able to enjoy those spectacular evening lights. Feel free to unmute. You can practice warming up your voice. This really is a very different style of webinar, and you can actually take me off Spotlight. I don't need to be spotlit for this as we're welcoming and getting people going. So we can see everybody. Katie and Jonian, I hope I said your name correctly, from Nevada, and Kiri, and Ali and Annika, Jennifer Perry, Cloris, I hope I said your name correctly as well. Carol Harvey. No aurora borealis in Texas, what?
I know, Jenny, I was just going to ask, I was curious if you got to see it in Oregon. Did it come that far down?
I did. I saw it on Friday night, May 10th, and we had more of the pink purple hues going into the fluorescent green on the bottom late night, but we didn't get much movement and undulation. It was very cool and really fun to just walk out in your backyard and see it.
Mm-hmm. We have had the experience. Oh, sorry. Please, Carol.
Sorry. I was like, Texas might have had it, but we had clouds. So there you go.
Oh, darn it. Just like the eclipse.
I think maybe we might have been able to see it in Massachusetts, but I don't do anything after supper time usually. But we have had the most amazing rainbows lately. I don't know what it is about the recent weather, but 2 times in the last month, the brightest, clearest, most amazing double rainbows that I've ever seen in my whole entire life. It was so cool.
Wow.
Yeah.
We had one that looked like a child's drawing. You know how when a child draws a rainbow, it's the entire arch.
Yeah.
It was incredible.
Wow. Well, Melissa, I'm sorry you sprained your ankle. That doesn't sound very safe. And we are here today as part of the Children's Safety Network. So I will continue to try and focus on being safe, even in our efforts to run out and see the aurora borealis in its rare showing. I'm going to go ahead and move us forward because I know we got started right at the top of the hour. That's right, Terry. No injuries. Cannot have the Tennessee team suffering any injuries. So once again, I'm Jenny Stern-Carosone, Associate Director of Children's Safety Network, and I'm very glad to see so many of you joining us today for our State Technical Assistance webinar. When these are events that we host every other month. So we are now hosting on May 16th, 2024, and we will again join in July. Go ahead, next slide. CSN is funded by the Health Resources and Service Administration of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Centers Cooperative Agreement with the Maternal and Child Health Bureau. While we are funded and that drives much of our work, it's important to note that none of the statements today are representative of positions of the U.S. government. Next slide. As you're joining, I'm sure you were all very Zoom focused. So a couple quick reminders. This is an engagement event. So you have the capacity to be on camera, to unmute yourself at any time. But we do ask that when you're not the speaker that you please do stay muted. And you can use the chat and we'll hold questions in the chat. We're going to have plenty of opportunity for discussion. If you're just now joining, we do love to know where folks are from. So take a moment and add your state abbreviation to your name. We will be recording and we'll share the recording as part of our archives on the CSN website. If you need captions, you can do so by clicking the captions CC icon at the bottom of your screen, and captions are available to any user that wants them. Next slide, please. We are very, very honored today to have two phenomenal presenters, both part of our CSN staff and team. Bina Ali is the director of the Children's Safety Network Economics and Data Analysis Resource Center. No, we don't try to say that often. CSN EDARC. This is a center that is operated by the Pacific Institute of Research and Evaluation, which we commonly refer to as PIRE. Bina received a Ph.D. in public health and graduate certificate in measurement, statistics, and evaluation from the University of Maryland. She has experience in behavioral health research and program evaluation, specifically in the areas of injury and violence prevention and substance use prevention. Bina regularly analyzes violence and injury incidents, trends, disparities, and cost using fatalities, hospitalizations, and emergency department visits, as well as other surveillance data to help Children's Safety Network determine priority issues and to drive our strategic planning. Bina also is part of our team that provides technical assistance on understanding, accessing, and utilizing data to facilitate violence and injury prevention efforts. Rebecca Hoffman, her colleague, is also a member of the CSN team and works at Pacific Institute of Research and Evaluation. And Rebecca received a PhD in applied social psychology from the George Washington University, where her research focused on health promotion. As a member of CSN EDARC, Becca is regularly using large data sets, such as fatality data and health surveillance data, to analyze incidents, trends, and disparities in child and youth violence and injury. She also is available to provide technical assistance on risk and protective factors and evidence-based strategies, as well as data analysis to prevent injury and violence. So with that, I'm going to hand this over in the capable hands to Bina and Becca to move us forward for the rest of the presentation.
All right. Thank you so much, Jenny. That was such a long introduction, but yeah, it's just humbling to hear that. So thank you so much. It's an honor to work with CSN. And my colleague and I, so Rebecca and I, are very excited to be here today and talking with you all about data use and data access. It's one of the topics we've been hearing over and over again, such an important topic, and we felt like it required its own separate time to have these conversations. So we have some objectives for today's conversation. So next slide. Yep, thank you. So our objectives are going to be review the importance of data that would guide our injury prevention work, understand the challenges of those data accessing issues, discussing creative ways to access local data, learn about some free and publicly available data, discuss how how states have identified and used data, I'm using it in a plural form, and identified and access data to guide their prevention work. But we're just scratching the surface here. So we want this conversation to get started and continue as we move forward in our work. We're hoping that we can talk about some of the challenges, identify some of the resources that we use regularly in CSN work, and also hear from you all about what you're doing that might be more innovative, and we can all learn from each other that way. My colleague and I, we've developed these slides, but we really want it to be a discussion throughout this presentation. And we're open to anything that you want to bring up as we're talking. Either you can unmute and talk, or you can use the chat or raise your hand. All of those functions are fine. Ask questions as we're sharing these contents, and also examples. Sometimes we don't have questions, but we might be doing some innovative work that we want to share with others, so others could also be learning from what's happening in other areas. So this could be a good opportunity for that. So we're hoping that that will be the way we'll have this presentation. Okay, next slide. Okay, so let's start with a recap of the last STAW. This STAW is built upon the last one that was in March. Sorry, this is May. In March. In March, we focused on SMARTY objectives, and we talked about the development of the SMARTY objectives. when I was in grad school, we were taught how to create SMART goals, but as our understanding of diversity issues and health equity issues have been brought to attention and really gotten the attention that it needs, the field has gotten to the understanding that we need inclusion and equity in our objectives as well. So now we have SMARTY goals. What are the SMARTY goals? So specific refers to the identifying actual outcomes that we want to accomplish, knowing what the population is and by when we want to accomplish those goals and by how much. So those are like the specific items we want to measure. Measurable means that the data can be tracked to see how we can assess progress over time. Attainable gets at, well, even though we want the objectives to be challenging, we want them to be realistic. So this gets at like, is it achievable for us to get to those goals based on the resources that we have access to in our community? So that is making sure that we're identifying challenging but attainable goals. Relevant means that our objective is going to be linked to the priority of our program, and we're taking into account we're trying to be mindful of the population of focus that we want to make sure that it's being addressed through this objective. Time bound is having the time frame to achieve our objective. So is it 1 year objective? Is it a 5-year objective? And that would also determine how specific you can get at how much change do you want to see over that time course. Inclusive is making sure that we have invited and incorporate input from the population of focus. They're presented at the table when we're developing these objectives, and they have an input in what type of changes and contacts that they are working with, and it's incorporated into these objectives. Equitable is seeking to address systemic injustice, inequity, and oppression. So this is taking into account that are the objectives addressing the underlying needs and the circumstances of the population of focus. So SMARTY objectives are designed to reach the populations of focus, and we work closely with the communities who are greatly affected by the disparities when developing these objectives. It is also about sharing power. So when we're talking about addressing disparities, we want the people in those communities who are affected by these disparities to be sitting with us at the table and guiding us through that process to see the change. And we're not working for the communities, we're working with them and making sure that the changes that we see could also be sustainable. So it serves a lot of different purposes. All right, next slide. So that was just a recap, but as we're thinking about data use and data access, we still have to keep in mind the importance of SMARTY objectives, because those could be driving us. What type of data are we looking for, and how often do we want to access those data? So in order to develop SMARTY goals, we want to look at data to understand who are the populations that are affected by disparities. So we want to get a picture of what that looks like. We want to look at data to see how the trends look over time and to assess if the disparities are widening or are they shrinking, because that could also help us think about how much change can we realistically see given these changes happening over time, and the change that could be made through the program that we're trying to implement. And then we also want to take into account, all right, so we have these SMARTY goals, we have this data, and these are the populations we want to be working with. Are the partners, who are the partners who can help us do this work? So SMARTY goals could be used or the data could also be used to identify who the partners need to be. And this can all be used as part of needs assessment. So even before the program begins, you're doing a needs assessment. You could be looking at SMARTY goals. You could be looking at data to identify what exactly is the data telling you about where the needs are, what the resources are, who the partners are, what the disparities look like, and get a picture of the community that you're working with. So we know the states have their Title V 5-year needs assessment due next year. This is the type of information you could be putting in your needs assessment based on data. And even after you've developed the SMARTY goals, you need data to monitor your progress and assess the outcomes. Data monitoring could be helpful when you're trying to see, are you seeing the patterns that you want to see as the program is happening? Are there tweaks to be made? Are there new things that got identified through the data that you hadn't thought about before. So data could be so important in just taking a continuous look at it throughout the course of the program. And data helps to also show why the program is important, how the work is being meaningful, and what is getting accomplished. So all of that comes back to data, and it's not something that we want to think about all the time, but it's always need to be in the back of our mind as we're working on our programs. Okay, next slide. Okay, and we use data, like I feel like we use the data in a very broad way, but we could be referring to so many things too when we're talking about data. What is data? Basically, any information that is collected in systematic way is data.
Unfortunately, things are messing here with travel maybe to a grant work.
Excuse me? Someone try. Can you all hear me?
Yes, you are loud and clear, Bina. Sorry, that was
All right,
someone who
thank you.
was just
Okay.
unmuted. That's okay. Keep on going.
Well, so I did say if you have questions, interrupt me, jump in, because I want it to be a conversation too. So feel free to speak up. I just have a few kind of overview to start off with, but then I really want it to be engaging, as Jenny had indicated earlier at the opening. All right, so when we talk about data, it's any information that's collected in systematic way. Primary data could involve going out, collecting our own data from participants, and those participants could be community members, key informants who are working on the program or helping with the funding allocation or resources, recipients of the programs, actual participants or residents who are getting affected by those programs, providers of the programs, so the staff that's going on and providing services. There are some disadvantages as well as advantages to this type of data approach. Disadvantages being that we go out and collect our own data. It requires sometimes starting from the very scratch, like figuring out what the design is going to look like, how we're going to go out and collect data, completing the institutional review board forms, finding resources to collect data that includes staff time, cost, incentives, all those issues come into account, and then entering and coding data and then making it available for use to our program. Advantages being that, well, we're getting to ask people exactly the type of questions we want to know about, and then using that to make specific informed decisions for our program. And on the other hand, we have secondary data. Secondary data involves using data that is already available to us, and this could include data that are being collected in our local communities, data that the government agencies might be collecting. So for example, the Youth Risk Behavior Surveillance System, it's collected by the CDC, it's available every 2 years. Disadvantages of such types of data are that they are limited by whoever collects that data, and we don't get to have a say in how those questions get asked. They're just available to us to use. And also, we don't know how often they will be collected. So there are some disadvantages there. Advantages being that, well, these data already exist. We don't have to make the time to design the questions, to go out, recruit participants, get their information. It already exists, and oftentimes it's inexpensive. So there are benefits to both. So I just wanted us to keep that in mind when we talk about data. We're actually talking about a lot of different avenues for accessing those data. Great. Next slide, please. And there are some more complex issues when we're talking about data, and those get down to challenges to accessing and using data. Sometimes a challenge is that a program team doesn't know where the data exists, where it lives, and how to access it. And even if they know where they want to get the data from, they don't have the partnership to start having access to those data. I want to actually see if you all can use the raise hand feature and raise your hand if you have experienced that type of challenge in your work. So you can go to the reaction button down at the bottom and do raise hand. All right, I'm seeing a few hands go up. It's pretty common. All right, okay.
And Bina, this
Wonderful.
is Carol Harvey in Texas. I also find that nobody collects the data the same way, so you can't use it the same, if that makes sense.
I love that approach or that perspective, I am going to, if you want to talk a little bit more, we could talk about that, or you can elaborate later if you feel like you have like an example to share as well. But if you just want to elaborate on your point right now, I'll just pause.
Well, just that we can find different data sets, but you can't necessarily merge it because they kind of come at it from different perspectives. And I don't have a current example. Back in the day, when I was younger, I just found that it was sometimes you ask the question a little differently, and then all of a sudden you can't compare them. It's like comparing apples to oranges to tangerines. So.
Well, keep that thought in mind because we're definitely going to talk about that as a challenge too. All right. Well, thank you so much for just making sure that we're talking about realistically what is happening on the grounds when we're using these data or accessing them.
That was, that's a good point, Carol. And the other thing that we've found over the years is like the way they run it might be a different age group. Like our highway safety office runs it for NHTSA's purposes, and for our purposes, we're going to look at a different age group because it doesn't make sense sometimes the way they group the ages together. Because if you're really doing a program targeted on 15 to 19-year-olds, they want to include 14-year-olds. Well, we're not really focused on them, and so then you're trying to get another entity to run their data different. So there's a lot of non-communication on how to, work together as well to run data that can be more beneficial to a larger population of people that use it.
Thank you, Jenny. That's a very important consideration too. Yeah. Okay. And then some of the other challenges that we have heard about is that there are limited resources, and that could be we know what data we want to collect or access, but we don't have the staff allocated to do that accessing or collection of that data, or complete the necessary trainings, the requirements that it takes, the MOUs, the data agreements. So sometimes it's about cost and time too. So those are also some of the other challenges. What could you all raise your hand if this is also one of the challenges you've experienced around limited resources? Yeah, I feel like everyone is going to raise their hand for this one. Yeah. All right. I only see one person, but yeah, like
this is Carol again.
Yeah.
Sometimes you can find funding, but they have an agenda of their own. That's not a great, that's not, I'm not making it, I'm making it sound like it's a bad thing, but it's not. It's kind of like, we'll give you the money if you add this.
Yep. And Carol, you're getting at what I put under the system level issues, like there are policies and different laws around accessing, but it could also be around different protocols and procedure requirements that the agency has around how you can collect data, what data to collect, how to share that data, restricting the use of the data. So those could all fall under like what you're able to do. Even if you have the data, you don't have the rights to use the data the way you want to use because you're binded by what's in the protocol and the procedures and the laws. Is that what you're getting at?
You should add politics to that. So I know there's certain words in Texas we don't use. So just saying.
Raise your hand if this is something that other states are also experiencing around the policies, procedures, protocols that might be restricting the use of data. That's very interesting. Thank you so much. I really appreciate those perspectives. We have a couple of more challenges that I want us to talk about, if that's okay. Next slide, please. So I continued here where we have challenges where we talk about, Jeannie, you might have already started thinking about this one, but the data security analysis interpretation challenges. concerns about the privacy confidentiality, especially when it comes to the small groups, or if we are not able to really look at. So, for example, we at Children's Safety Network, we're focused on 0 to 19 age group. There are certain types of injuries and violence issues that are more common in different age groups. So if we're breaking it down by smaller age groups, we're looking at small numbers, and the confidentiality of those participants might become concerning if there's only a small group that gets affected by it, but it's an important topic. So we need to talk about it. How do we collect data from that? So there are sometimes fears about misusing the data, misunderstanding the data, sharing the data that may not get clearly communicated. So there are some questions about just sharing those data and making sure that the interpretation doesn't get misunderstood. So raise your hand if that is also one of the challenges that you experience when you're trying to use the data. Mm-hmm. Yeah.
And Bina, sorry, I'm
No, go ahead.
in the peanut gallery, I know. I think it's also one of those where it's how people actually report some of it. I'm thinking specifically around suicide, that's a difficult thing to get professionals to report on, just due to the sensitive nature of it and considering families. And so sometimes it's really hard to interpret the data the right way, if that makes sense.
Yeah, no, you're absolutely right. Sensitivity of the data, right? And then the other item that I listed on here, and I know there are a lot more challenges too. So, but then the other ones that I listed here have to do with the compatibility, timeliness, completeness. Are we getting the data in the right format so that we can actually use it? Like sometimes we get them in hard copies, and then requires getting and being entered into a program where we can actually analyze the data. Frequency of data release, we don't have much control over. If we're trying to access data that's being collected by someone else, how often are they collecting it at regular intervals, or sometimes it's not predictable. So that could also be a challenge, the frequency of data release. And then the missingness of the data. Like we're trying to get a full picture of the community we want to be working in. So if there's missing data, it makes us question, is the data really informative or not? So there are a lot of questions that come up, and concerns, and the challenges when we're trying to find data. Raise your hand if this is also one of the challenges that you all have experienced. Mm-hmm. All right, kind of tells us, right? Like it's not something uncommon. Not everyone is experiencing the same sort of challenges, but they're happening in the field. So I always want to acknowledge that it's easy to talk about, yeah, why don't we just use data to guide our actions? And there are challenges. So it requires consideration and thoughtful actions. Next slide, please. And then here I was thinking, if we all can just unmute and spend a couple of minutes talking about what have you experienced, if you can give some examples of how you have navigated those challenges, because I think sometimes it's interesting to talk about how do we work around those challenges. So any examples from any states?
I know that for us, the delay in suicide data has been something that's been challenging. People in our state and, our partners, they want up-to-date data, and they sort of feel like we're almost halfway through 2024. We should have 2023 data, but we don't. So, I mean, even on our website right now, it's only through 2021 because 2022 is just being finalized. So something that we've been able to do is we've been able to work with the epidemiologists in our Center for Health Data Analysis at the Department of Health. And we've been able to get them to agree to release some preliminary 2022 data. So even though it isn't completely approved through CDC, we can look at our state database to kind of determine at a certain point when the things that might still need to be finalized will have a sort of a negligible impact on the actual data. And so we've been able to kind of do preliminary data releases. So at least we're not completely up to date, but we're getting a little bit better and trying to meet the needs of our partners.
That is a great example, Kelsey. And what a big accomplishment getting provisional data, getting those released. That's a big deal. A lot of states have different policies around it too. So congrats to you all for getting that. Thanks.
I just was curious if you could just take a quick moment, because as Bina noted, that is, quite a hurdle to get over. And I was curious if you could share just some of the strategies that you use to be able to navigate that challenge.
Yeah, I mean, I think a lot of it happened. I think it's sort of a work in progress, and it started before I was in my position. But I know we have a really close working relationship with our Center for Health Data Analysis. We call them CHADA. So we work really closely with the epidemiologists in CHADA, and I think that's really helpful. Like, we have a shared vision of what we hope to accomplish through data, and we all sort of agree that the goal is to use the data and apply it to the work that we're doing. So I think having a shared understanding has made it clear that, like, we understand their challenges. And I think it's made it easier for them to understand why, like, the needs of our partners and why people want to see this. So I think that's been like the biggest thing, is just getting on the same page. And I think, it can be challenging when you're coming from two different angles, when you're coming from a data angle and a programmatic angle. And if you can't get on the same page, then I think it makes anything like this really difficult. So that's definitely the biggest thing. And then I think the other piece is that we just have had repeated requests for updated data. And every time we get a request for updated data, we just share it so that they know that it's not just coming from us, it's coming from community members, it's coming from partners, it's coming from media, it's coming from all the angles. So I think, they're getting their own requests too. So I think once they can see how we're also receiving that, they sort of see the volume, and then that's helped as well.
That's great. And that's leading into our next slide, Kelsey. So Rebecca, if you could move us forward. All right, so here are some of the ways that we have heard, and then please add to it if there's something that's not getting covered here, but some of the main ways that we have been able to circumvent the challenges or heard partners being able to do that: identify publicly and locally available data. If the locally available data is taking some time for us to build that partnership, getting access to it, then maybe start with what's already available and then building upon that. When we're identifying data that's already available, we just have to really be mindful that the data is really going to be related to the objectives. Again, we're going back to the SMARTY objectives when we're thinking about data and how to get those data. It could be qualitative or quantitative, and it doesn't matter if it's getting released on a monthly basis, or a quarterly basis, annual basis, as long as it's going to help us inform the needs and the monitoring of the program, and also help us see the outcome in certain ways, then it's a relevant data source. And identifying proxy data, sometimes it's very hard to get actual outcome data, but identifying what are some behavioral health data that could help us see where the injuries might be happening. So, for example, we may not have access to data from hospitals where they're seeing self-harm related injuries, but we have access to school-based data where they're collecting surveys from students who might be experiencing mental health problems. There isn't a one-to-one ratio between mental health problems and self-harm. However, there is a correlation there, so we can use that as a proxy measure while we're waiting to get the partnership in line or get access to the outcome data that ideally we would like to use, but it's not currently available. So kind of like seeing if there are creative ways for us to work with the data that's already available and using that as our starting point. Strategic partnership, that's exactly what you're talking about, right, Rhode Island? Just identifying common goals between the agencies, try to see that we're actually working towards the same goal, but might be approaching it from different angles. But it's related, so being able to see that and have a supportive collaboration, and maybe a liaison who could be helping between the two divisions that are sharing data, Sometimes it requires identifying partners who are not within our agencies to help us see where the data lives and how can we be accessing that data. Sometimes we have to go through our hierarchy of chain and our leaders who connect with their leaders, and then it needs to be a little bit more formal. But sometimes it happens naturally. Like we go to a meeting, let's say a town hall meeting, and then they're being represented and we're there and we talk about, oh, wait, we have access to these data. So we can like see if there are ways you can develop partnership. And these partnerships could be formal or informal. If we're trying to come up with more formal, then we could have MOUs, data sharing agreements too. And here, if there are concerns about, how the data will be shared, what about the privacy, confidentiality, it could all be written out. And that way, both agencies are clear on how those data are going to be shared and there aren't any confusions around misusing that data in any way. And then having designated staff. It's easy to say than do, but it is important when we have designated staff who are helping with accessing those data, using those data, then it makes it easier for us to make sure that the data is being used throughout the course of the program and it's not going to be an afterthought. So having designated time for the staff to help them prepare and share that data with the programmatic team. Sometimes it's easy, sometimes it's not, but to the extent possible, we could be trying to see if there's a way to integrate that into our program goals, that we'll have a staff, designated staff with resources to help us with the data. Okay, next slide, please. All right, sorry. So we have some data that we have listed that we use regularly in our work. And these are the examples of some of the existing data that we have used. I just wanted to put it up there, different ways we could be trying to access these data, use these data. But I will turn over to my colleague who's going to go more into the use of publicly available data sources.
All right, thank you very much, Bina. All right, so we're going to shift gears a little bit and talk about some publicly available free databases that y'all can get what we hope is going to be some very helpful data. We originally intended this to be a poll, but a little bit of tech issues. So just a little bit of an overview. These are going to be some of the publicly available data sources that I'm going to be giving you a little bit of a glimpse of. So we were intending to kind of get a sense of what you all commonly use, maybe what's less commonly used among you all, but just kind of think about that. Which one of these are a little bit more common in the work that you do versus which of them sound kind of new to you. All right, so we're going to be throwing a lot of information at you about these publicly available data sources. But we really thought that these, or we're hoping that these would be helpful to you as you're creating your SMARTY objectives. These are also just kind of a sample of all the publicly available data sources that are out there, but these are one that we commonly use when we're trying to inform CSN's objectives. So here we have whiskers. So you can see that we have the acronyms here, but at the bottom of the slide, you will see the entire names. And thank you, Jenny. I was just going to mention, there's a lot of information here, but you will be able to return back to this after the presentation when everything goes up online. There also is a hyperlink to the data sources website, so you can go ahead and click those and get to looking at your data. So WISCRIDS provides fatal and non-fatal data. And you'll see that there are some differences and some similarities. So they provide similar contents in that they each provide counts, rates, leading causes of death in the case of fatal whiskers and injuries in the case of non-fatal whiskers. And they also conveniently allow you to filter by intent. So was it intentional self-harm? Was it accidental? And mechanism, what actually caused the injury or the death? Was it a poisoning? Was it a motor vehicle crash? And also the demographics of the person who died or was injured. But you'll see here that the main difference between whiskers fatal and whiskers non-fatal is actually where the data is pulled from. So whiskers fatal draws from the annual mortality data file of the National Vital Statistics System. So that's NVSS. And these data are based on ICD-10. So that's the International Classification of Disease, the 10th revision. And because it pulls from that, it's actually census data. So it's very convenient that we get actually all the exact numbers of the people who have been identified as dying from a injury or violent occurrence. So no estimates are involved. On the other hand, Whiskers non-fatal comes from the hospitals that specifically participate in the National Electronic Injury Surveillance System. So that's NICE, all injury program. So in this case, there are estimates involved. So keep that in mind. Also keep in mind that not all injuries end up being reported to a hospital or an ER. So keep that in mind when you see the numbers. It could be maybe underestimating the amount of injuries that occurred that year. So you'll also notice that Wonder, CDC Wonder, looks very similar to Whiskers Fatal, and that's because they came from the same source. The data is pulled from the same source, so NVSS, and they're also based on ICD-10 codes. What kind of makes Wonder stand apart from Whiskers Fatal is that basically it provides more information. So the data that's offered by Whiskers Fatal is only deaths that were caused by injury or violence. If you're looking for an occurrence that's not injury or violence, for example, SUID, that's when you would turn to Wonder. Wonder also provides county level data. So just keep Wonder in mind if you're looking for different causes of death besides injury or violence, such as SUID. These are all run by CDC and are collected and reported annually. And also keep in mind that there is a lag. So a lot of people were mentioning that you don't get the data as soon as it's collected. There is going to be about a 2 to 3 year lag in actually being able to see the data. Okay. Next we have YRBS. Or YRBSS, I tend to refer to it as YRBS. So that's the Youth Risk Behavior Surveillance System. And that is, again, administered by the CDC. These are to high school students every other year. And the purpose is to track health behaviors that contribute to the leading causes of death, disability, and social problems among youth in the United States. And it is nationally representative. But take note that not every state participates in YRBS, so there's not data for each state. But the way that it's sampled, it does make it nationally representative, and for any state that does participate, the data is representative of that state. When it comes to the National Survey of Children's Health, this one is run by HRSA, the Maternal and Child Health Bureau. And these surveys are administered to caregivers of children from the age of 0 to 17, and that occurs annually. It allows you to filter data by many different variables, which makes it very rich of different data that can be reported. Something to note, both of these data sources have really easy to use and easy to interpret query systems. But keep in mind that if you want to take a look at the data and perform more complex analyses, they are also available to download publicly and no cost to you, so that you can download those from the websites. Again, you can just click the hyperlink. Something that is a benefit of NSCH is that they present data, sorry, I keep switching back and forth. Don't mean to be doing that. They present data by the national performance and outcome measures. But also keep in mind about the who are reporting here and some of those limitations. Think about things like desirability, how people want social desirability, how they might want to maybe skew what they're saying to not look bad or have their children look bad. All right, and again, keep in mind there is a 2 to 3 year lag. All right, PRAMS is the Pregnancy Risk Assessment Monitoring System. So it's a surveillance project run by the CDC, and it is administered to women who have recently had a live birth. So participating jurisdictions use birth certificate files to sample 1 to 3,000 births per year. For this one, take note, we actually can't consider this to be nationally representative. Not all states are participating, and it's sampled in a different way compared to YRBS. So it's similar in that if a state does participate, the data are representative of the state, but when we're aggregating all the data, we can't consider it to be representative of the United States. And then lastly, we have FARS, which is run by the National Highway Traffic Safety Administration, that's NHTSA, and it contains census data of all the police reported fatal motor vehicle traffic crashes. So again, because it's census data, like in Worcester and Wonders, we see the actual number of deaths rather than estimates. And so keep in mind, we're kind of just skimming the surface of all the data sources that are out there, but we were hoping that these would be helpful to you all as you work with your SMARTY objectives. Oops.
All right, Rebecca, if you don't mind, I'll take over here. All right, so just a reminder, there are different data sources, different ways to access those data, use those data, different methodology. So leveraging multiple data sources is always a good idea. So that's just a reminder here. Next slide, please. Just trying to be flexible, think of proxy data as you're doing it, and then thinking about having partnerships across different divisions and settings so you can get the most out of the data that's available. All right, so we'll get to the next questions. These are just some reminders for you. We really want to just take a couple of minutes that we have to hear about how, if there are examples that you have, how you have identified and used data to guide your work. Again, we want to learn from you all. So we'll take a couple of minutes to hear from you.
This is a great opportunity for folks. I know we've already had some engaging conversation. I so appreciate it. This is a great opportunity for folks to come off mute. I mean, if you want to put your question in the chat and that's a preference, you certainly can. But we know you're all using data. We know that you're all experiencing the myriad of challenges that Bina has already identified, and you're probably using a multitude of the resources that Becca shared with us. And we've already heard from in the chat, Bina and Becca, just to point you, there was some great exchange from Carla and Terry about creating injury data matrix type documents that cite multiple data sources and help to organize them, be it on a specific topic or otherwise. And it looks like, you know, many of those are available in a public environment. So it's great to hear about these kinds of tools and resources.
Right, and just to wrap up, again, thank you all so much for sharing your experiences. It was great to hear, and hopefully your peers benefit from getting to hear about your experiences as well. We'll skip through these. We appreciate that you kind of asked your own questions, provided some of your own experiences, and didn't cause us to need to probe. So really quick, as we wrap up, for all of you CSLC members, don't forget about your outcome measure worksheets. You have some great resources kind of right in front of you. They are found on the CSLC website, and you can take a look at your specific injury that you're working with and take a look at which data sources have been suggested for you to use. And finally, a reminder that you can always contact us for TA. So Bina and I are always available for TA to help with data access and utilization. Here are just some examples of things that we can try and help you out with. I mentioned how the query series systems that there are for YRBS and National National Survey of Children's Health have excellent data queries systems. So happy to work and walk through those with you. And really any way we can help you find the best data that can help your work. That's what we're here for. So if anyone has any final questions, and please, if you could just take a couple minutes, fill out these brief evaluations so we can learn about you, how we can provide some more information that's that will benefit you all. That's why we're here. Also take a look at the website for childrensafetynetwork.org and follow us on social media.
So we still have a couple minutes before we have to wrap up, and I do want to just open the floor to additional questions or comments. I see Jeannie's
something that we've been tapping into around our teen driver safety is our Department of Motor Vehicle licensing data. Provides a lot of good information on who takes driver's ed, who doesn't, and then you can compare each county. Like if they have a low rate of driver's ed uptake, may most likely have higher rates of crashes. So we're using that data. And another one that we're kind of looking into as far as schools is that Nebraska has a Nebraska educational profile data, and it gives us information about each of the school districts and like by school student performance, reduced lunch, how many kids are on reduced lunch, things about ethnicity, race, poverty. So not sure yet how we're gonna tie that in, but we're looking at that as our next kind of data set. We use all the data sets that have been spoken about before, and we use codes and all of that, but just our DMV data and then our Nebraska school profiles is something kind of new that we're looking into.
You bring up an interesting point, Janie, that even if you have the data, it's about how do you want to use it and what do you want to study and how do you want to apply that into our practices. So how do you make sense of that data and how do you want to communicate that with the partners? And the first thing that comes to my mind, and I think you guys are already doing it, like GIS mapping with the data to identify hotspots and areas where the programs could be tailored to.
Yeah, we have our codes data, and we have like our top 10 counties for teen drivers, rates of crashes, rates of speed, if they're related to speeding, distraction, improper driving, those kinds of details, because, fatality data is sometimes too high level for people. And they're like, well, we didn't have a death in our county, so why should we kind of pay attention to this? Well, you've got a high rate of crash. You had 500 kids in crashes and you had this many injuries. So a lot of times, the deaths don't really impact local communities. I mean, they do, but not when you talk about when you have higher numbers of injuries and why is that happening? They want to know why. And so if you can kind of show them more details, it's very helpful.
Thank you for sharing that.
Another common challenge that I've heard, working with teams in our Child Safety Learning Collaborative is, the challenge also about, as Becca, you were talking about, that we have all these free national public data sets that are available and so forth, but sometimes it's hard to find that connection between your state data and what you're seeing in the national data, as well as, as we noted in the beginning, the timing of when data is being released in the different venues. I'd love to hear from states about your experiences with that challenge. We've got about 3 more minutes left. Maybe some of your successful strategies to navigate those challenges. We have everything from Rhode Island to Texas on this call today. We know that those are vastly different state populations.
What are you saying? I'm fat?
No.
Not what we're saying.
I don't think Texas has ever been called fat, but
I think Rhode Island could fit in Austin, couldn't it?
Stop it. Stop it.
Sorry, Rhode Island and Texas. I didn't mean to signal you out that way.
No, that's okay. They're not sensitive about their size. Texas is pretty proud of it.
Does Tennessee.
First of all, great presentation. Thanks. Data is always a challenge. I would just tell people, don't give up. Keep asking. Form partnerships. I mean, we've asked for years for a data sharing agreement with mental health in Tennessee around suicide. And what happened is the person that worked here was wanting that data sharing agreement with mental health. Never could seem to get everybody together on it, lawyers, etc. And she left our position and went over there. And then through the advocacy on her end, continued advocacy, she's still doing crisis services stuff and we're doing the prevention stuff. We were able to get that agreement. So just keep asking. I mean, that's part of the thing. Keep asking. You'll never get the data if you don't ask, or you'll never get processes to change. But it can be a slow process. We have the same challenges you guys have, you know. The data's a year and a half behind. Our people are understaffed, and so they have a hard time cleaning that data and getting it released. This year was particularly challenging. We have counties that want to know how many people died in my county by suicide, even though it's maybe 3 people, and we have rules about not releasing that data. We can't release that data. And getting them to understand that why we don't release that data has been a real challenge over the years. And then also, even this year, we had some legislation passed that we have to show data with this year data. Well, it's not available.
Yeah.
So we're going to have to change our processes at the Department of Health to meet that law. It doesn't go into effect until 2025, and I'm not in charge of changing those processes. But I'm just saying, times are tough all over, but you can plan with imperfect data. You know, another example we had was, you know, we had a group that really pushed and wanted suicide autopsies or a suicide fatality review team. Well, we do have a child fatality review team in Tennessee, and that's pretty expensive to do 100 reviews. But to do 1,000 reviews, that's going to be $5, $6, $7 million to find information that might contain some nuggets. But we generally know what the risk factors are and protective factors are for suicide without investing $7 million in a full-blown, you know, fatality review system. I'm not knocking it. If your state already has one, wonderful. But I think you have to pick and choose sometimes about what you know, how valuable is the data for the work. And so I'm just throwing all that out there I know this is the very end of the session, but it might be some fodder for another session. Just to tell you that times are tough all over, and that's good. It's fine. Feel free to reach out to me if you want, and we can lament together.
Excellent, Terry. Thank you. And yes, I mean, I do really feel like this is a big nut to crack. And you know, this STAW was developed in response to requests that we got from members of our Child Safety Learning Collaborative. We are looking ahead and developing additional STAWs, you know, throughout the course of the years to come. And so we do truly take your suggestions to heart. So, you know, I think that this does require part 2 and looking into, you know, the issue of leveraging your data effectively from other aspects. So let us know in your evaluation what you would like to hear on that. Please don't hesitate to reach out for TA at any time. And a reminder that we are hosting another fantastic webinar where we'll be featuring some of our teams from the Child Safety Learning Collaborative, not the laboratory, on May 22nd. And we would love to, you know, hear from you at that as well, and look forward very much to hearing from Kansas and Georgia on the work that they've been doing and how the CSLC is impacting that. So thank you again for joining us today. And we just didn't have enough time. We'll look forward to seeing you all again at the next STAW and digging into this deeper at another date. Thank you. Have a lovely day.
Thank you.
Thanks, everyone.